Welcome to St. Elizabeth Medical Center. I'm Dr. Jeannie Gorham, Director of Obstetrical Anesthesia. You may be about to have a baby, or you may need to have a gynecological procedure, and we want to help you understand your options for anesthesia. These are critical decisions that you and your doctor will want to discuss, and the following information will help determine which option is best suited for you. Before your procedure, you'll need to meet with your doctor. It's important that you provide your complete medical history, including any pertinent information about this or previous pregnancies. Be sure to explain any prior problems that you might have had with anesthesia. You need to bring complete lists of both medications that you are presently taking and medication allergies. And don't forget, when you arrive for your baby's birth or for your gynecological procedure, you'll need to let us know what and when you last had anything to eat or drink. All of this information allows you and your medical team to determine and execute the best anesthetic plan for you. If you're having a gynecological procedure, most likely you'll have a general anesthetic or perhaps a local with sedation. With a general anesthetic, you will be completely unconscious and an airway will be inserted to protect your breathing. Sometimes serious side effects are associated with general anesthesia. These can include injury to teeth, breathing in vomitus, and very rarely death. Of course, our highly skilled and experienced medical team is prepared for such events should side effects occur. If you're here to have your baby, you will want to consider all the options that are available to you. You may choose to have an epidural or spinal anesthetic, or you may consider natural childbirth with intravenous pain medications. Occasionally, your doctor might determine that you need a general anesthetic during the birth of your child. Regardless of your choice of anesthesia, prior to any procedure, a well-functioning intravenous catheter is always placed for administration of fluids and medication. It's important to remember that anything given intravenously to the mother or any anesthetic that is inhaled can also produce an effect on your baby. These effects might include a sleepy baby, a baby who doesn't want to breathe, or low APGAR scores. Let's take a closer look at the option of epidurals and spinals. There may be a little discomfort in placing the epidural or spinal needle, but local anesthetic is used to minimize this discomfort. With the epidural, the needle used for placement of the tiny epidural catheter is removed. Medication is then injected through the epidural catheter, providing pain relief during labor and delivery. Once medication delivery has begun, you will experience numbness and weakness of your legs, so you will not be able to walk around after placement. Occasionally, an epidural or spinal anesthetic does not work properly. In this case, it may be necessary to redo the epidural or spinal. An epidural for labor does not always eliminate all of the pressure sensations associated with labor, which is good, since you'll need to feel some of this pressure during the delivery of your baby. With cesarean deliveries, the epidural or spinal will not completely block sensations from within your abdomen, but these sensations are usually brief and easily treated. As is possible during any medical procedure, serious side effects can occur, such as spinal headache, nerve injury, and low blood pressure, but these are very rare. You can rest assured that your medical team will be constantly communicating with you and monitoring your progress. Their skill and experience will enable them to do everything possible to minimize any of these side effects. Both epidural and spinal anesthesia are excellent choices for labor, delivery, and cesarean section. You will remain awake and be able to see your baby right after birth, and your husband or partner can also be present at labor and during delivery. With spinal or epidural anesthesia, the baby gets very little of the medication given, so there are minimal effects on the baby. You may choose to have natural childbirth, and if you do, you will remain awake during labor and delivery. But should you decide that you require some pain medication, your obstetrician can order an intravenous injection to make sure you are as comfortable as possible. I hope the information we provided here will help you understand your options for anesthesia during your delivery or gynecological procedure. If you have any questions or need additional information, the medical staff is available at any time to help. Our anesthesia staff is highly qualified and experienced. We have handled thousands of births and procedures, and will do everything possible to make sure your visit at St. Elizabeth Medical Center is safe, comfortable, and in the case of a new baby, a happy experience for you and your family.